Okay, good morning once again, Washington State. We are going to go ahead and get started. I want to say thank you for your patience this morning. It was very much appreciated. And I'd like to go ahead and make a couple introductions for you. Firstly, my name is Amanda Pauley, and I'm with DBHR, Foundational Community Supports, as a Supportive Housing Program Manager. And I would like to introduce to you, please, Kira Schneider, Melinda Trujillo, Jason Bliss, and Alan Muya. I'm so sorry, Alan, if I messed up your last name. Please give me forgiveness. Anyway, we're going to talk to you today about recovery housing in Washington State. Please make sure that any questions that you have, you pop into the question box, and we will go ahead and go and answer those towards the end of the presentation. So I'm going to hand it over to our presenters, and thank you very much. If you're speaking, we can't hear you.
Okay. Can you hear me now?
Yes, ma'am.
Hello? All right. Sorry. I haven't gotten this phone thing together yet. Good morning. This is Melinda Trujillo. Go ahead, Kira. You can move it to the next slide and the next one after that one. So this is one of our Oxford houses, Morton Street house. Go ahead and turn it to the next one. I'm going to kind of give you a little bit of history on sober recovery homes in Washington. So way back in the 1988, President Ronald Reagan, I think probably everybody knows that his daughter was an addict, and he was very grateful for the help that he had received in getting her into recovery. And so he worked really hard on getting the Anti-Drug Abuse Act law signed in, and that established a nationwide program to encourage mass replication of recovery houses. Well, at that time, he didn't know what he could do for all the states nationally, and so he pulled in Oxford House. At that time, Paul Malloy was well known around the Senate, and so he knew about Paul Malloy and his recovery and his Oxford houses, and so he pulled him in, and they talked about what they could do for each state that would be long lasting. And so they came up with the idea of all of the states would receive a block grant of a revolving fund. It was only a one-time deal of a revolving fund in fiscal year 1990 that would pay for opening sober recovery housing. It was offered to each state. Go ahead and turn it to the next one. And of course, that would establish a nationwide program to encourage mass replication of recovery houses. And it was kind of based on the Oxford House concept. Now, it wasn't said, oh, well, you're going to have to open Oxford houses. That wasn't it. It was just kind of based off of it, because at that time, that was the only concept that was really going on in more than just one state. So Oxford houses actually came to Washington State in the early 90s. Ken Stark at the time was the director over, I'm going way back, it was DASA, Division of Alcohol and Substance Use, I think is what it was called at the time, administration. Anyway, it came, and they just kind of handed the money out. Each state got about $200,000, and some of the states refused it, and once you refuse it, you don't get it. So that was kind of sad for some states, but we took it, and then we just kind of started handing it out with any kind of policies or procedures around it. And before they knew it, $100,000 was gone, and none was put back into the revolving fund. And so the state had to come up with some kind of policy and procedure so that they aren't going to continue losing all that funding. So the state came up with the policy and decided they looked at different ways of trying to get that money back into the revolving fund. And they had heard about Oxford houses, so they brought management to Washington State, and they brought some other folks, and they did a lot of looking at different ways of doing this, and decided to bring Oxford House into Washington State because they had structure already in place to be able to open houses here in Washington. So when I came about 16 years ago, we had about 125 houses, I think, and we had 3 outreach workers at that time. Needless to say, the Oxford houses were a good fit for Washington State, and Ken Stark had to go to legislation and had to ask for $100,000 to put back into the revolving fund to make it $200,000 again. So go ahead and turn it to the next slide. So the Anti-Drug Act allows states under the Alcohol and Drug Abuse and Mental Health Services Block Grant to establish the revolving fund to make loans for the cost of establishing programs. Now, it's not much. It's only $4,000. It's to establish the program with the provision of housing in which individuals recovering from alcohol and drug abuse can reside in a group of no less than 6 individuals, ensuring the programs are carried out in accordance with the guidelines published in the Federal Register. So this is actually a law with the Federal Register, and it's cited here, dated Wednesday, April 19th, 1989, Group Home for Recovering Substance Abusers Guidelines. And then it's to ensure that no less than $100,000 will be available for the revolving fund. Go ahead and move it to the next slide. And ensure each loan made from the revolving fund does not exceed $4,000. So now I'm going to hand this over to Jason Bliss. Jason has been in this position about 7 years with Oxford House here in Washington State. He's our coordinator. He coordinates all of our outreach workers. Like I said, we had about 3 when I came on board 16 years ago, and we have now, I believe, 15 outreach workers. So he's got his hands full trying to coordinate and ensuring that each region in Washington State has an Oxford House outreach worker looking for more houses to open. Jason, you're on.
Awesome. Good morning, everyone, and thank you, Melinda. I'm going to continue on here. Each loan is repaid to the revolving loan fund not later than 2 years after the date of which the loan is made. With Oxford House, it takes quite a little bit of, we'll say, bookkeeping and keeping up with the reports to be sure that there's accountability out there for all of our houses and such. But the Oxford Houses of Washington State have a rather high repayment rate. We try to do our very best to see to it that the houses are able to stay on top of that and get those loans repaid. Part of it is to ensure each loan is repaid through monthly installments, and a reasonable penalty is assessed for each failure to pay by the date specified on the loan agreement. Ensure such loans are made only to nonprofit private entities agreeing in the operation of the program established. Oxford House, since its inception back in 1975, has always been a nonprofit. I'm sure Alan is going to touch on here in a little bit about some of the new loans that are going to be out there and that are going to be available to other nonprofit service providers as well. Well, also part of this Anti-Drug Abuse Act public law it states that the use of alcohol or any illegal drug in the house is prohibited. Any resident who violates that rule will be expelled from the house. Next slide, please.
So can you explain that a little bit further? Because this is one of the big bugaboos that everybody just really focuses on, that immediately they're kicked out of the house and then that's it. Can you explain a little bit more about why they're taken out? What do you guys do with them? What happens?
No, absolutely. Oxford House since its inception has had a hard, fast rule in place that relates directly to this anti-drug abuse public law. If a person returns to active use in any way, shape, or form, the house has an emergency house meeting, and that person is expelled from the house. The person is not expelled from the house for life, as some rumors are out there. If a person is not in too great of shape, whether they've relapsed or returned to active drinking, we would never put a person back out on the street where they would harm themselves or be of harm to another person. The individuals in the house, once a person is relapsed and is asked to leave the house, the other house members there, sometimes the chapter officers or the outreach people, sometimes have to get involved. We do our very best to see to it that that person has somewhere safe to go other than the Oxford House. Our biggest reason behind this policy, other than it being part of the federal law, is to protect the other people inside of the house. Oxford House has had this policy in place since its inception back in '75, and this policy, along with our other Oxford House policies and procedures, is what's got us recognized by SAMHSA and placed on their best housing practices list. Next slide. The cost of the house, including the fees for rent and utilities, will be paid by the residents of the house. And the residents of the house, through majority rule of the residents, establish policies governing residents in the houses, including the manner in which applicants or residents are approved. So Oxford House, our model, our financial model for each one of the houses is no secret. Basically how it is set up, we go out on an as needed basis as new houses need to be open, and we work with investors to hopefully find us a new suitable house. If we decided, just a hypothetical, that we need 10 new beds in an area, we will go out and look for an 8 or 9 bedroom home. Oxford House has always had that we have 1 or no more than 2 shared rooms in every home. That way, when the newcomers move into the home and they're voted in, they have that further level of support system with somebody there with them, so they're not left in a room isolating with questions and such that may or may not get answered. Once we find that 8-bedroom home for the 10 residents, we figure out what our cost is to the landlord. So if the residents in the house have a rent amount of $4,000 for that home, we add another $1,500 to that, bringing the total cost of the home to $5,500. That other $1,500 includes all of the utilities for the home, the cable, the internet, the phone, water, sewer, garbage. That includes coffee, household cleaning supplies. In our women and children's houses, that includes feminine hygiene products. So then we take the total amount of the $5,500 and we divide that by 10, and that's what each one of the members pay in the home every month. When the house is first set up and first opened, they receive a housing manual all of the residents in the house, including the core members that move in to open that house. They thoroughly go over the Oxford House housing manual with all the individuals there, so they understand all of the policies and procedures that are in place. They also set up at that time on a house by house basis some of the further house rules, such as what time quiet time is going to be in the house, how late some of the children are going to be up, and various different things like that. Next slide, please. Current Oxford houses in Washington State. As of the current month, we have reported that we have 336 houses, and that encompasses 2,918 beds. We have total women's houses of 105. Of those, 45 are for women with children. We have a total of 231 men's houses, and 18 of those houses are for men with children. These houses are broken down by numbers in the following categories. Next slide, please. As you will see on here, we have a list of all of the counties in Washington State in which we currently have houses. It displays on there the amount of houses that we have and the total amount of beds. This is just in part some of the statistics that we keep and maintain and turn over to HCA on a monthly basis. We also keep a very close count on how many children that we have living in each house. We keep a count on how many individuals have been interviewed, how many have been accepted, how many move out, as well as we keep a close count on those with OUD, opioid use disorder, living in the homes. Next page. Current number of children and MAT due to opioid use disorder in Oxford House. Children, we have 166 children living in our 336 homes throughout Washington State. We also have 1,060 residents on MAT therapy due to opioid use disorder, and again, we have a total of 336 houses here in Washington State. And again, that the numbers of the children in the house and those as self-identifying as being on MAT therapy, those numbers are tracked monthly by the houses, by the chapters, and then reported to me, and we get those numbers onto HCA. Next slide, please. And with that being said, I'm going to turn this over to Alan. Thank you.
All right. Shira, do you want to do any introduction of this section, or shall I dive in?
I'll just say that my name is Kira Schneider. I am the Recovery Residence Program Manager with DBHR at the Healthcare Authority. Alan Mua is the president of the Washington Alliance for Quality Recovery Residences, and also is an owner-operator of a couple of these residences. So I will let Alan go ahead and kind of give you all a background of recovery residences and give you a little bit of in-depth of how they work here in Washington State. Take it away, Alan.
Great. Thanks, Kira. I wasn't fishing for an introduction there, but thank you. That was kind. I just want to start off and just say we are really the new kids on the block in terms of being an organization relatively new to the landscape here in Washington. And so I want to talk about our inception and a little bit about recovery residences outside of Oxford House in general, as we're all kind of part of the bigger picture. So first, I'll start by talking about NAR. NAR is a National Alliance for Recovery Residences. It was founded in 2011, although there were remnants of NAR, components of NAR in existence long before that. NAR was formed by a group of folks who across the country, state folks who were operating recovery homes of all shapes and sizes, and came together to form a national presence. There were a number of states who already had statewide organizations that had been functioning for years, since really the 80s or even before. In the case of Georgia and California specifically, had been doing this for quite a while. And by this, I mean certifying recovery homes. So their mission was to adopt a standard that, regardless of the shape or size of a recovery house, that there are certain things that they, certain hallmarks that they were looking for in homes that would distinguish them as offering really quality service to their residents. So NAR, again, began in 2011, and shortly after their founding started working on a national standard. So taking those state standards that already existed, getting a bunch of really purposeful and intelligent people together to form something that would hold up across the country, that would speak to both, all kinds of recovery housing. And so they came up with a model that we're going to talk about here in a minute or so. NAR has now 30 recognized state affiliates. So organizations, NAR as a national organization doesn't certify their homes or accredit their homes by themselves. They work through the state affiliate process. So when a few of us providers from Washington contacted them back in 2016-17 to say, hey, we'd like to get some of our homes certified, the NAR folks said, well, we don't do that. We do that through state affiliates. And then we said, well, then who's the state affiliate in Washington? And they said, there isn't one. So that really was our birth story. We said, well, we need to really move in this direction. So the Washington Alliance for Quality Recovery Residences, or WACR, started in 2017 with a 2-day meeting in Seattle, in which we discussed the need, for a network of providers in our state to share information, to support each other, to keep each other updated in the field, but also to create some accountability so that, as you all know, if you've paid attention to the news in the last several years, there have certainly been providers out there who have, in the name of recovery housing, really done some harm to people. And so we really wanted to set ourselves apart and open all of ourselves up to some accountability and say we're willing to subject ourselves to that in order to be known as somebody who operates with integrity and really wants to do good work on behalf of the residents that we serve. So we started, we adopted the standard NAR in 2013, then 2015, created this national standard that I talked about. We adopted the 2017 version of that standard shortly after our formation, and then we set about creating the process to do this accreditation with homes. So in late 2018, we accredited our first set of homes and have been slowly building that number ever since. We've been doing that largely until just a month or two ago as volunteers. So really trying to get off the ground to create a system and really work with the small number of folks that we have at present. That number is growing, and we're continuing to reach out more and more and more. So since the passage of House Bill 1528 in 2019, which Kira is going to talk about in detail here in a few minutes, we've been working really closely with the Healthcare Authority to refine our accreditation process, which will essentially feed into the state registry, which was created by 1528. So that state registry, in order to be listed there, recovery residences are going to have to be accredited by us first and meet those standards. So let's we'll talk more about that relationship, I think, when we talk about 1528. But if we can go to the next slide. I want to talk about levels of care. So when NAR was first founded and tried to sort of put their arms around all the variety of recovery homes that are available out there across the country, they had to figure out, how do we organize them? How do we put them in some sort of a scaffold so that people can understand how, if we could group them in some way. So they came up with the concept of levels of care as probably the best way to do that. And so they came up with really 4 levels of care that encompassed, to the best of their ability, the landscape that was out there. Level 1, you've heard about already, really largely represented by Oxford houses. So these are homes that are peer-led, they're democratically run. The best example, of course, is Oxford House. Oxford has a charter that really governs what the houses look like on the ground in concept, but all the decision making around who is accepted, when a resident needs to be released, what kind of policy, if there's a policy infraction, what happens, how and when bills are paid, all of those kinds of things, those all happen at the house level. And so residents are largely in charge of their own destiny in that regard. And so they benefit greatly from the support and the accountability that they receive from their peers, but they aren't, they're not usually in the earliest sort of unstable stages of recovery. They're folks who have, by and large, some recovery capital under their belt so that they can do some of these functional things. They pay their own rent, or if they get assistance to pay rent, they're navigating all of those systems on their own. And so again, level 1 homes are largely represented by Oxford. There could be level 1s out there that aren't Oxford houses, but we wouldn't necessarily hear about those because they would have, they might be just a group of people who said, hey, we want to adopt some standards around sobriety here in our home, and they are not calling on outside support. And so we would just call that a household of people who are supporting each other. And again, we wouldn't necessarily know about them. Level 2, then, you can read the descriptions as I go along. I'm not going to read to you. But level 2 homes are generally owned and administered by somebody outside of the house. So might be a property owner who wants to help and really be instrumental in the lives of people, really be agents of change. And so they make their property available, and they'll have some input in terms of who gets let into the house. They'll generally have a set of standards and guidelines. They'll also have what we call, generally speaking, a staff member, at least. And a staff member, that doesn't necessarily imply pay. So a lot of these folks, they're called house managers or house assistants, will do that work maybe in exchange for rent reduction or free rent, or they'll have some other arrangement with the landlord or the provider, and their job just to be on the ground to kind of help facilitate whatever structure the level 2 provider has in place. And so that may be a paid position. There may be somebody outside of the house who comes in and offers some sort of service, but generally speaking, these folks are pursuing their lives, school, work. Generally speaking, they're paying as well for their stay, and generally speaking, level 2 providers are paying their expenses largely as Jason described, as happens in Oxford, where they take the total cost of the residents plus maybe some additional cost for utilities, etc. Divide that among residents. There may be some external source of funding there, but largely they're self-supported. At least as we've seen so far in our state. Next slide. I'm going to go out of order here because I think level 3 is the most sort of complex, and so I want to talk about level 4 because it's pretty cut and dry. Level 4 facilities are what we would call residential treatment. They're highly structured. They offer relatively short lengths of stay. Part of that has to do with the expense. They're generally paid for it could be private, but largely funded by insurance and other mechanisms because they're staffed with certified professionals. There's a higher level of care, there's a higher level of accountability, etc. That generally costs more. So the stays are generally shorter. 30 days, 60, 90 if you really get qualify and can get that paid for. But generally that's the outside. In the recovery housing world, we strongly believe that folks who are exiting the treatment environment really are going to do best by going into another kind of home that's a lower level of care but still offers some accountability and support. And we colloquially say that letting somebody out of treatment just with no aftercare is like sending a heart patient just after heart surgery into the parking lot of the hospital and just asking them to go and fend for themselves. And so, which we all know just doesn't lead to a lot of success. So that's where the rest of the recovery housing world, including Oxford and the rest of us, can be really helpful. Is after that stay. So again, what distinguishes a level 4 residence is this clinical environment, shorter stay, and generally folks are there really highly structured time and experience. So level 3, then, the definition varies quite a bit from state to state of what a level 3 residence is. There are some general parameters. Some of those are written here on the slide, but essentially, what separates level 3 homes from level 2 homes is the amount of structure that they provide. So you can think of sober homes or level 2 homes as residences with some structure and support, but which allow for residents to engage in work, school, or other pursuits on their own. Level 3 homes serve residents with, generally speaking, with less recovery capital, who can really benefit from more structure as they recover. So we are, when we think of a level 3 home, we're thinking of something with some program elements to them. We're currently working to answer some questions with the Department of Health, who's the licensing agency for level 3 and level 4 homes, around questions like, yep.
I think I'm on mute.
Oh, sounds like someone may need to be muted, but I'll keep plugging along here. We're currently working to answer the questions of how much support and structure a provider would need to offer before their residence would be considered a treatment setting that requires licensure. So on the surface, that might sound pretty easy, but there are some questions that providers are asking around that so that's a really current issue that we're working through. Essentially, there's a whole range of support that can be offered. One, at the real basic level, just peer support, like you would find in any Oxford house, that's not structured, it's not licensed, it's just peers helping peers, all the way through support services like financial coaching or conflict resolution training, or it could be a number of life skills kind of areas like that, where providers, either through partnerships in the community or in-house, kind of provide that level of support to folks who maybe, because they don't have a lot of recovery capital, need to sort of gain some ground in those areas. So level 3 and level 4 homes in Washington are licensed. Level 3, Kira is going to talk about the recovery house designation, which is a part of WAC, which definitely fits into the level 3 program. Those are licensed, and those have, of course, Department of Health oversight, as well as just like a level 4 residence does. So I think that's probably a good place for me to leave off, and then I'm more than happy to answer questions at the end about the wide world of recovery housing. So I'll turn it over to Kira.
Thanks, Alan. Okay, so first, I'll kind of touch on what Alan was talking about regarding the recovery house licensure for through DOH. It is a WAC interstate policies, and so it's a very confusing set of terms here in this state. We have recovery residences, which Alan was talking about. We have recovery house, which is a licensed and certified dwelling that offers all of the kind of services and treatment programming that you would see for recovery for SUD treatment. And then there's just a general term of a recovery home that we use. And we use that term to be the inclusive term of recovery residences, recovery houses, and also tribal recovery homes as well. So it's a little confusing. We're actually looking into potentially changing, seeing if we can get away with changing the names, especially with recovery house, maybe change that back to a recovery residence. And so, yeah, that's kind of in the works, just as a side. But to get back to what started this whole thing was House Bill 1528. It was introduced by Representative Lauren Davis in 2019 during legislative session. The purpose of the bill was to address the quality of recovery housing in the state of Washington. Like Alan had mentioned, if you had heard the news in the last few years, there have been a lot of issues with nefarious residences that were calling themselves recovery residences, doing things, that just weren't. There was like patient brokering with treatment providers. There was just a lot of, how can I put it without sounding really, really negative? Just taking advantage of the people that are in recovery and need the support. In some cases, some of these residents, the owners of these residences, especially in Florida, were basically operating slums. And so with this, there was a big push to, bring about, to push the NAR standards and make sure that there was accountability. And so that's what we've decided to move towards here in Washington State. We wanted to, the legislation wanted to make sure that we were addressing, the fraudulent and unethical housing operators in the state, and to give the people in the state somewhere that they could go to that they know they would be safe. The first main part, the bill required HCA to start up 4 different things. They required us to create a registry of approved recovery residences, and Alan mentioned those will be the recovery residences that are accredited by Walker. At this point, the registry will only be dealing with levels 1 and 2 for housing purposes, but also know that there are levels 3 and 4 type housing, the DOH licenses, and you would be able to find those on the DOH website. The second part of the bill was to provide technical assistance to recovery residence operators through the state affiliate, which is Walker, to create and manage an operating revolving loan fund, and to create and manage a capital revolving loan fund. So, I did have a slide on this. So this is what I was talking about, the type of recovery homes that are here in Washington. So, which we kind of went over already. So the collaboration between HCA and all of our partners throughout this state has been really an awesome thing to see. We convened a work group and invited recovery residence owners and operators, SUD treatment providers, Oxford House, tribal partners, and other state agencies such as Commerce, DSHS, and DOH. This work group was then broken down into smaller groups to specifically focus on the 4 parts of the bill. As of September 17th, which was just last week, an advisory group was convened to assist with the revolving loan funds. The The group has been put together to assist and finalize creating policies and procedures for our operating revolving loan, and to go over and complete the application to be submitted for the loans. The advisory group consists of partners from HCA, Oxford House, the Fletcher Group, Walker, and MCOs. The advisory group will also include reviewing of the applications as they start to come in. So Walker's role in regards to 1528 has been a program support role. They will be providing technical assistance to anyone that is interested in recovery residences. It includes one-on-one technical assistance over the phone, or it used to also include in person. Obviously with COVID right now, that isn't really happening. They also are offering webinars that are going to cover multiple topics on best practices and support for emerging issues. They will have also been tasked with doing in-person events, focusing on recovery house licensing through DOH and Medicaid reimbursement. They will have an all-day intensive review of recovery residences, the NAR model, emerging issues, licensing and reimbursement. They will be doing a train the reviewer events to train people to provide fidelity reviews for Walker recovery residences, and also offer fidelity reviews for upcoming and current Walker recovery residences. When we started this back in, let's see, November of last year, DBHR, myself, and along with our FCS housing trainers, thank you Amanda and Kimberly, kind of worked with Walker on reviewing their accreditation policies and procedures and their interviewing and that kind of thing to get them to focus on making it a fidelity environment, so like a more of a learning collaborative, so they can help them bring in other operators into the review process so that they can learn from each other and what's happening. And that, from everything I have been told, has been quite successful. I was able to participate in one yesterday morning, and it was a lovely thing. And Walker, because of who and what they are also providing their expertise to DBHR and HCA on recovery residences and the NAR model. A little bit about the registry that I briefly mentioned. That this registry is going to be housed and managed by HCA. We have created a web page on the hca.wa.gov website that is directly related to recovery residences. It's a little work in progress. Right now, there's just some summary information up there. But the registry is going to allow for a one-stop shop for recovery homes. It will include Walker, Oxford House, and Tribal, as we didn't want to have any unforeseen negative circumstances arise from creating this registry. And the launch date for this registry is hopefully October 15th, 2020, so that's coming up pretty quick. The registry creates a list of eligible SUD recovery homes for future funding streams and access to the revolving loan funds. It will include an interactive map, which will allow those using it to sort by different filters, find contact information and vacancy information. Those of you that are familiar with the FCS provider map that HCA has created, it's going to be something very similar to that. It's going to be fancy and pretty and all those good things to keep your attention on it. Also, according to the legislation, as of January 1st, 2023, substance use disorder providers will only be allowed to refer patients to the recovery homes on the registry. Of course, they will also be able to, what was I thinking? My apologies. Providers will also be able to still refer patients out to any of residential treatment facilities and the WAC recovery houses, as those won't be on the registry, but they are still licensed by DOH. The operating loan fund, it is modeled after the Oxford House revolving loan fund because it is using the same type of money that Oxford's revolving loan fund is using. This is federal money through our block grant, so we have to make sure that we are following the conditions that are listed in the block grant. Ours is going to be a $500,000 total fund. There'll be loans of $40,000 to be paid over 2 years. Like I said, we're still working on the application process, but we do hope to have the funds available for application by October 31st of this year. The funds are available for any nonprofit on the registry, and those licensed by DOH's Recovery houses will also have access to the funds. The funds can be used for operating startup costs, such as rent and mortgage payments, security deposits, salaries for on-site staff, minimal maintenance costs, and to help assist pay for licensing and certification. So the next few slides are some resources, and these slides will be made available after the presentation. So we have some Oxford House resources, their vacancy list for Washington, their national website, and the Washington State Association for Oxford House's website. Recovery residents resources, so Walker's website, NAR's website, for any licensing information from DOH, we have their website, and below is going to be the website for recovery residences on HCA's site. Lastly, here we have just recovery support resources for Alcoholics Anonymous, Cocaine Anonymous, Crystal Meth Anonymous, Heroin Anonymous, Marijuana Anonymous, Narcotics Anonymous, and Young People in Recovery. So at this point, Amanda, if you can help us go through all of the questions and stuff, we will be happy to start answering those.
Sure, no problem. So let's go up to the beginning and we'll work our way down. So there is a question about voucher programs. Is there a voucher program for those who have little to no money? And I'm assuming they mean vouchers that will cover their time in recovery homes or Oxford houses.
This is Jason. I'll go ahead and take that one. There are a wide variety of voucher programs out there available through the state of Washington. There are some out there through the different counties. Some of the treatment providers have chosen to use some of the CJTA dollars to assist some of the individuals that are in full compliance in the treatment centers with some housing. There's a wide array of ways that people can get funding in order to move into the clean and sober housing. Yes, when they don't have the available resources to be able to do so.
Thank you. Okay, is a level 3 like a recovery house?
I can take that. So the short answer is yes. At present, level 3 homes are really synonymous with recovery house. And by recovery house, I assume you're referring to the recovery house as described in the Washington Administrative Code. And so that is really at present the kind of quintessential model of what we're calling a level 3 residence. The question we're pondering is are there other residences that fit into level 3 aside from recovery house? And we're just not quite far along enough in that discussion to be able to give guidance to providers and so on. But we're working on those answers, so we're getting there.
Okay, thank you. So this is again about levels in recovery houses, so but different. One of our attendees would like to know if you can share, if someone can please share a link for the registries for the HCA approved residences, and how can people utilize or access a list of level 3 and 4 homes.
So there's a, oh, sorry, go ahead, Kira, you want to do that?
Yeah, I'll take care of that. Right now, I don't have a direct link for the registry, but on the slide that showed the recovery residence resources, at the bottom was a link to the recovery residence website on HCA's main website, and it'll be on that page that you'll be able to find the registry. In regards to the levels 3 and 4s through DOH has a what they call a green book, which is a list of all of the licensed facilities in the state of Washington. And you can do a search in there for residential treatment facilities. And what you would also do a search for is recovery house, is that is a credentialed service that is provided on that. We can send you later, we can send out the link for the green book if you would like.
Right, and in the state of Washington, we really don't have a level 3 at this time through Department of Health. I don't think that exists in the state of Washington. So it's usually just a level 4 intensive inpatient residential.
Well, the level 3, as I understand it, from the HCA and the DOH communication we received recently is that we're calling level 3 the actual recovery house designation. There are 10 of those, I believe, Kira, and those are licensed.
Really?
And we're calling those level 3 residences. Yeah.
Yeah.
Are they saying that in the green book? Is that written
they're
out
not
so
saying
people
that
will
they're level
know?
3, no. What it just says is that they provide the recovery house services. And so that's what you would look for.
Okay.
Sure.
Okay, so are we ready to move on to the next question?
Yep.
Okay, so if we could, if somebody can pop that link into either my email or into the question or chat box for our audience, that would be fantastic. So that way we can at least give as much like direct information as possible. So another question is, can we get a list of individuals on the advisory group and the advisory group contact information?
I assume we're talking about the loan advisory group, right? I'm assuming that's about the.
I would at this point, I don't want to give out the contact information for each member, but you can reach out to me directly, and then I will find out from the advisory group members if they are open to having people contact them directly regarding the information. And my email address, you can see, is kira.schneider@hca.wa.gov.
Thank you. Another question is, what would be the lead time on the wait list?
Which wait list are we? What wait list?
Let's see.
If they can kind of clarify that, that would help.
For an individual that applies until placed into a recovery residence house?
Yeah, so it really this is Alan, and I would say it largely depends. Oxford House has their own house by house process. So Jason, if it's okay, I'll answer that for them, and then I can talk also about recovery residences. But essentially, in an Oxford House, you would apply to a particular home, and then the person, there's usually a check-in protocol that they check in regularly with the home to let them know they still want to stay on the list, and then as an opening comes up and that person is accepted into the house, then they can come. That is largely what the process looks like in other residences as well, although it may vary depending on the level of care and the kinds of criteria that homes are using to accept residents. But it can be, I'll just say this, the challenge with waitlists, and probably everyone on this call knows, is that when someone needs housing, they need it shortly or soon or now. And by the time the spot comes open, often that person has found something else or is otherwise not available anymore or not looking anymore. And so it's really hard to work with waitlists in general. That's a general comment I would make. But I'd also say that, and I didn't say this as plainly as I should have, we are short in all categories and all levels of care. We need more houses. We need more Oxfords, more sober living homes, and more homes that have extra services of support. No level of care is better than any other, and so we've got to have, we're short in all of them. So I'd venture to say there are wait lists at all levels. Yeah, for sure.
I'll touch on that. Alan did a very good job of explaining Oxford House. Oxford House is well switched to kind of an online platform. As far as the Oxford Houses go in Washington State and for all across the U.S. for that matter, we have it's called oxfordvacancies.com. It's a very interactive website. Once an individual logs on to that site, they put in the city, state, and county in which they would like to reside. They can put in what type of house they're looking for, whether that's men, women with children, or men with children. And then it will give them an interactive list, per se. It will list all of the homes that are out there that are currently available. It will give them real-time information as to how many vacancies are at each home. It will provide them with a phone number directly to the house, as well as a contact cell phone number for each house. Once a person finds a house there that they're interested in with a vacancy, in the top right-hand corner, they can hit the Apply Now button, quickly fill out the application, and then once they hit Submit, that application is instantaneously sent via email to the house. Then the individual can simply follow up with a phone call, either to the house number or the contact number directly, and find out the times of their next house meeting or how soon that they can conduct an interview for that person.
Thank you very much. So Melinda and Kira, this would be more geared towards you, I believe. Oops, and it went away. Hold on. Sorry, guys. Sometimes things just, there we go. So somebody wrote in here, level 3 recovery house programs have dwindled in Washington over the years because of low reimbursement rates. Is the HCA looking into sustainable rate for these programs?
At this time, no, but it's definitely something that should be brought up if it's a concern. I'm trying to think who the best person would be to reach out on that. I don't know off the top of my head, but I'll figure out who.
Yeah, it's got to be someone in MPO, someone in the healthcare authority.
Yeah, well, but we'll bring it up definitely to them.
Thank you. So there's no more questions after that. Do you guys want to type some more questions into the chat box? So that we still have 30 minutes technically, so it's perfectly acceptable to ask whatever questions are relatable to this. So we'll give it Kira and Melinda, Jason, and Alan. We'll give it a couple more minutes and give people an opportunity to type in the chat box any additional questions or comments. And then if they don't have that, unless you have more to add, we can actually end early and give people some time back, including yourselves.
No problem. I'd like to also say that I went ahead and I entered into the chat box the link to the Recovery Residents page on the HCA website.
Thank you. And I will go ahead and copy that and add it to the, that is a fantastic question. Tisha asked a great question. How could SCS providers work or partner with recovery houses?
I'll leave that up to Alan and Jason.
Sure. Go ahead, Alan. I'll go ahead.
Sure, yeah, I'll let you clean up for when I'm done. But I think a real key to success in recovery residences is honestly to stay in our lane. And what that means for us on the ground is we want to do what we do best, which is to support our residents at whatever level of care that we operate in. So just my own experience is on the ground having really important all kinds of partnerships, but with providers of outpatient treatment services, medical providers, especially around medication-assisted treatment and MOUDs. Vitally important that there be just really open communication there. We work really closely with obviously hospitals and treatment and detox providers all over the place. So really important. And then also thinking about providers of permanent supportive housing, where there might be folks who are in those programs who really want to take a step toward a more sober lifestyle. And so we really see ourselves as part of a continuum of care, so that when someone wants to take that step, that we've developed really good quality relationships with everybody in all of those contexts, so that people can seamlessly move back and forth, and there's a network instead of something that feels more like a competition or a group of providers who just don't know each other. So I don't know if you're looking for anything more specific, or Jason, if you want to throw in your thoughts there too. But
sure. I think Alan touched on some of the key important things. I feel that open communication amongst all of our providers and open networking is the key to making this whole thing work. There's a lot of clients out there, a lot of individuals that need help. For those of us that have been doing this a while, not necessarily is one treatment provider the best for every client, just as the same as one housing provider is not the best for every client as well. Mm-hmm. I think that I just think that networking and open communication. We've got with Oxford House, there's 15 of us scattered throughout the state of Washington. I would gladly share my contact information, the rest of the staff's contact information with any of you. And yeah, we would gladly be more than willing to network with any of you, have communications with any of you, and continue to build relationships, because it takes all of us together to be able to make this thing work.
Thank you, Jason. That's great.
I kind of want to add to that. So one thing that with recovery residences and Oxford houses are generally considered transitional housing. You know, it's not granted, you know, with Oxford House that there are people that choose to stay there, you know, until they pass away. And that's perfectly fine with the house and with Oxford. But in general, they're considered more of a transitional housing. In regards to FCS, their goal is more towards permanent housing. But I think that if the FCS providers are, when they're working with their clients, making sure that they have all the information that they can get on, you know, Oxford House and recovery residences and permanent supportive housing and all that, so that they can make an informed decision about where they want to go, is really important. You know, I mean, there may be somebody where a client comes in and says, hey, you know, into the FCS program, I want to go to, you know, Kate's house, you know, this is what I want. And I think the FCS provider reaching out to Kate's house and making, you know, having that discussion with them and getting all of the information that they can give their client, so that the client understands that, you know, there's a program that you're going to have to follow. You know, there's rules, this isn't a permanent place for you to live. It's considered, you know, I think Alan had said at one point, you know, 6 to 9 months sometimes, you know. And I think as long as you get allow your client to make an informed decision about what they're getting into or what their choices are, then I think that's, you know, that's what's important. Yeah, I think that's all I wanted to say, because I feel like I'm repeating myself.
Thank you, Kira. That was actually going to lead it right into what I wanted to add as well. So I want to make sure that if there are any providers out there, FCS providers, and you have you're looking for more information on what recovery houses and Oxford houses, how you can, the both of you can utilize one another's services in order to help participants move forward in their recovery, which, as we all know, is not linear. And so there are sometimes, like you mentioned, Kira, recovery houses and Oxford houses are traditionally transitional housing. And so for foundational community supports, we really want to make sure that we are offering as broad of a choice as possible for our participants. And like you said, if that means substance use disorder housing, where people go to experience the possibilities of clean and sober living, or if they decide that they're that living on their permanently out on their own is what they want, being able to work together as a unit, like Jason and Alan mentioned, is a huge piece of this. And so that cross-system collaboration, knowing your resources in your community. So the more you know about recovery residences, and the more you know about foundational community support or HEART, or, you know, whatever program that you're working for, this is a fantastic and rich resource in your community. And if your participant chooses to utilize it, getting to know people who work in this program is a really great chance to understand more about it as well, because they do differ somewhat from community to community. And so this is a fantastic way to help people move out of transitional housing and out of and off of the houseless situations where they're experiencing homelessness and living on the streets or in their cars. And so we do have another question, but so I don't ramble either, I would like to add in here. This person is hoping to speak with someone about working on opening recovery housing in Port Angeles and Port Townsend in the Olympic Peninsula. And they feel like, excuse me, that these areas are lacking in that kind of support, and would like to know who they can connect with in order to, and what that would look like. The process, I'm assuming.
This is Alan. I'm glad to be in a conversation with somebody about just, steps. We've consulted with sort of regional leaders before, people from particular towns who said, hey, we want to get something going. So we sort of orient them to what the questions are that they should be asking, who the people are they could be talking to, those kinds of things. So glad to do that. And obviously, offline, if you contact me, there's the name of a colleague who's working on the peninsula who I'd like to get you in touch with as well, who might be a good resource. Then I'll turn it over to Jason too about how you might want to contact Oxford. So.
I will. Like Alan, I'm more than willing to have a conversation with you if Oxford House might be an option for your individual needs or for your home up there. Like Alan, I will drop my contact information directly in the chat window here as well.
That's wonderful. Thank you. So we have, excuse me, another comment / question, and that is just wondering if in the future there will be capital funds that are not loans, but perhaps grants to help us set up new homes.
It's being worked on. We're currently focusing right now on the operating loan fund, but hopefully, if things go well, and it depends, I think, a bit on this next legislative session, on how fast we'll be able to get that up and going. But eventually, we are hoping to release the capital loans, but I don't have a date for you on that yet.
I'll say, as a nonprofit provider, I'll put that hat on for a minute, that there are organizations who grant for good causes out there. And so we've received grants to do building and purchase projects from large philanthropic organizations. Generally speaking, I'm not aware of any government help at this point. That may change over time as we continue to raise the profile of recovery housing, especially if you compare the deliverables and costs to something like incarceration, that we really are an excellent value. And so some long-term investment in this sector will go a long way toward the public good. However, now the landscape is such that I think your best bet is to go the nonprofit route and apply for funds via philanthropic organizations. So again, glad to have an offline conversation about some success we've had there, and even pass along some contact info. So.
Okay, so let's see what we have here. Thank you. That was a very detail-rich answer, and I appreciate that. It's wonderful to have those. Don't freeze. Sorry. So I think that's the last question so far. And so I see on here, Melinda and Kira, that your contact information is on here, and we're really grateful for that. Is there do we have a slide with Alan and Jason's contact information by any chance?
We don't, but both of them put their information into the chat box, and then I can give it to you directly, Amanda, because I think you send out an email afterwards, and we can include it in there.
Thank you. That's perfect. So we'll make sure that everybody gets the additional information as well. I have some links that I'm adding to our normal follow-up, and so that'll probably be out to everyone within 3 hours, depending on how long it takes the links for the recording to finalize. So
I also sent you I'm sorry to break in, this is Melinda. I also sent you the link to the Green Book or directory through the Department of Health on behavioral health providers, including residential treatment.
Thank you very much, Melinda. I went ahead and added it to the follow-up email already. So we are in the zone with each other, totally.
You're fast.
Okay. Do we have any more questions, anybody?
I also just wanted to put out there too, that if, at any point in time, if you have questions, regarding, each of these programs, you are welcome to reach out. I'm speaking on behalf of Melinda, but I'm quite sure she'll agree with me. Please feel free to reach out to either of us, Melinda for the Oxford House and myself for the Recovery Residents. And we can, answer your questions, find your answers, or direct you to another person to speak with. It's kind of what we're here for. We're sort of that point of contact where if you don't know where to go to us and we'll figure it out.
That is wonderful. So we will make sure that everybody gets the slides and a link to the recording and information about next month's webinar. And thank you. I want to say thank you very, very much to our very active and engaged audience. I also want to say thank you again to Melinda and Kira, Jason, and Alan. We really appreciate all of your time, your willingness to talk to us more about, about recovery houses and Oxford houses and figuring out how we can make that work with our foundational community support. So I'm going to go ahead and end the webinar now.
Amanda?
Once again. Oh, yes.
Sorry, there was something I forgot to mention.
Oh, great. Perfect.
If any of you are interested or know somebody that would be interested in joining our, basically our stakeholder work group, our large work group, I would love to have your participation in it. We're really trying to get voices from all, areas of the state and all different types of programs, just to kind of, hear your take on what we're doing. And, if you think something would be beneficial specifically to the program and linking it with FCS, those kinds of things, please reach out to me. I would love to have you on our work group. It meets quarterly. So the next meeting is going to be the beginning of December. But yeah, just shoot me an email, say, hey, I would love to be on your work group, and I will make sure the invite gets sent out to you, and I will be absolutely thrilled to have you on the work group.
Thank you, Kira. I'm adding that into I'm adding that into the email so that people who may have left early or didn't have an opportunity to attend but registered will have that information as well. So I just want to make sure and verify with you. So it is Recovery Houses Stakeholder Work Group, and it meets quarterly. Is that correct?
Yeah.
Okay. Thank you. Aside from that, does anybody have anything else that they would like to add? Okay, well, I'll take that resounding silence and the lack of questions. Is there, there's another question. Stakeholder work group, is there a website for it?
No, there is not a website for it. I've never been asked to create a website. And I want to say the reason why there isn't is things are changing so rapidly. To try and keep it updated with what's most current would just, for me, I don't think I could handle it. But like, if you want to know what's been going on in the past and up to this point, please feel free to reach out to me. I would have no problems having a conversation with you, either over the phone or via email, kind of let you know what we've been doing in the work group and where we're headed.
Can you briefly explain to our attendees, Kira, what exactly the stakeholder work group does?
Yeah, so what we've been doing with the work group, it's a larger work group, and we've been kind of bringing forth to them where, you know, what we've been doing and getting their feedback on what we've been doing. It's helped a lot with, you know, figuring out how to move the program forward in a way that's going to be most accessible to people in Washington State. The work group has been great on helping us figure out how to set up the registry and what it's going to look like. There's some people that are working on, we had a smaller group regarding the whole licensing and Medicaid reimbursement for levels 3 and 4 and how to promote that. You know, it's a bit of a catch-all for everything that we're doing to get this program implemented and moving forward. I'm trying to think of specifics other than that. But yeah, I can try and make up a list of everything that we've done in the work groups, Amanda, and maybe send it to you. And then maybe you could send an additional email out to everybody, if that would work.
Well, I did add in there to the email, to the follow-up email, that if they're interested in recovery, the Recovery Houses Stakeholder Work Group, which meets quarterly, to reach out to you directly, and added your email just for posterity.
Okay.
So if people are interested, I would just, instead of sending a giant email, I would just see who reaches out to you. Maybe that will help with you know, narrowing everything down.
Yeah, that works.
Okay, let's see. And I don't see any more questions. Feel free, we have 5 more minutes, so feel free, everyone, to type in any more questions or comments that you have, messages to the presenters, into the chat box, and I can go ahead and read them off. All right, I don't see anything yet. Do you have any additional comments that you would like to make, or anything that you would like to add before I thank everybody and we say goodbye?
Nothing from me.
None here. Thanks, everybody.
I think I'm good as well. I want to thank everyone for being here today, and just like I had brought up earlier, it takes all of us providers together and working in collaboration with each other to be able to make this thing work. I appreciate all of you.
Well, I just want to say one more time to Kira and Jason and Ellen and Melinda, thank you very, very much for your participation today in the webinar and everything that you do. And I will make sure that our audience has access to emails. And so thank you again, everyone. Washington State, if you are interested in future webinars, please reach out, and we will see what we can do about giving you as much upfront information as possible into 2021. I want to say thank you. Please stay safe, stay healthy, and we will see you guys next month for our topical housing webinar on the 22nd at 8:30 to 10. Take care, everyone.